Hello, Assalamu alaikum. Today I'm going to discuss another topic which is called scalp. The scalp, actually, this word is comprised of five alphabets, SCALP, and this each alphabet is derived from the first, from the five layers of the scalp. S from skin, connective tissue, A for epineuritis, L for loose connective tissue, and P for pericranium. So these five layers, they actually form the scalp, which is skin, connective tissue, epineuritis, loose connective tissue, and pericranium. And we would be discussing each layer in further detail in a while. So here it is again S for skin, then this yellow layer is loose connective tissue or connective tissue, then this third layer is aponeurosis, then fourth layer just beneath this aponeurosis is fourth layer which is loose connective tissue, and the fifth pericranium. So this is scalp. As we know that scalp, skin contains hair follicles. Hair follicles, if this layer contains hair follicles and sebaceous glands. So whenever the sebaceous cyst would form, it would be formed within the, this skin, because hair follicles are present only in the skin. So what is sebaceous cyst? Sebaceous cyst is actually, blockage of the secretions of the sebaceous gland, which results in the accumulation of the secretions within that gland and results in sebaceous cyst. And then connective tissue and aponeurosis. Aponeurosis is just a flat tendon and it is called aponeurosis. Flat tendon is called aponeurosis. Here you can see this aponeurosis is attached to two muscle bellies, frontal and occipital, and they are attached to aponeurosis. Aponeurosis is just a tendon but in the form of flat sheet. So this aponeurosis actually forms the third layer. So this third layer is attached anteriorly to the frontal part of the muscle and posteriorly to the occipital part of the muscle. The important thing to understand about this muscle is that this muscle, occipital belly, is attached to the superior knuckle line. Occipital belly is attached to the superior knuckle line, then anterior part of this occipital belly is attached to the aponeurosis. And anteriorly, this aponeurosis is attached to the frontal belly, and then this frontal belly anteriorly it is inserted into the skin. Now this is very important point to understand. This frontal belly, actually its insertion is into the skin, not onto the bone, not on the superciliary ridges, arches, or on the bone. So as a result, whenever there is bleeding or fluid collected within the fourth layer just beneath this epicranium, that bleed or that fluid trickles down because there is a gap between the bone and the muscle, because muscle is inserted into the skin. As a result, that fluid or blood will gather around the eyes, and that would around the eyes in periorbital region, and that would result in the formation of a condition which is called black eye. It has got different names. Then it is called panda eyes if both eyes are around it, if that collection is around the both eyes. That is called raccoon eye. For example, here you can see after trauma, most of you have witnessed that people after having trauma, they actually develop this type of black eyes, or blood gathers around their eyes and results in the condition called raccoon eyes. So this is an animal which is called raccoon. Just look at its eyes. It is surrounded by eyes are surrounded by black spots. So you can also call it a panda eye, because same likewise, bleed which gathers around the eyes and results in the formation of either raccoon eye or panda eye, and this same condition is also called this is also called this condition is black eye. So this occipitofrontalis muscle is actually this occipitofrontalis muscle is actually supplied by the facial nerve. So here you can see here the two occipital bellies, and these are two frontal bellies, and frontal bellies they get inserted into the skin, whereas occipital belly inserted into the bone, superior occipital knuckle lines. So as a result, the bleed is limited just above the occipital this superior knuckle line, as muscle occipital belly is getting attached here. Whereas in case of frontal belly, the frontal belly is inserted into the skin. Then we have got fourth layer. Fourth layer of is loose connective tissue, and this fourth layer is also called the dangerous layer. Why? Because most of the time fluid or infection, it actually gathers within the fourth layer, and fourth layer has also got the network of blood vessels, epicranial venous system, which is connected to the intracranial dural venous sinus, which we have already discussed. And as a result, any infection in the fourth layer could easily transmit into the intradural sinus. So extracranial venous system is continuous with the intradural venous sinuses with the help of emissary veins. Then we have got pericranium. Pericranium, as the name indicates, just above the bone, pericranium. So this pericranium is actually continuous with the endosteal layer of the dura mater at the foramen, greater foramen like foramen magnum and other foramens as well. So nerve supply of the dural venous sinus, nerve supply is, here you can see it is supplied by divided into two parts. Anterior to the ears or posterior to the ears. Anterior to the ears, they are supplied by supratrochlear nerve, supraorbital nerve, zygomaticotemporal nerve, auriculotemporal nerve. Then posteriorly lesser occipital nerve and greater occipital nerve. Likewise, the blood supply, in the same diagram you can see supratrochlear artery, supraorbital artery, zygomaticotemporal artery. So anterior to the ear, nerve and blood vessels are having same names, and then anterior to the ear there is a slight change, and that is superficial temporal artery instead of auriculotemporal nerve. Then we have got posterior auricular artery, then occipital artery. So again, supratrochlear nerve, supraorbital nerve, zygomaticotemporal nerve. Same names are being repeated in case of blood vessels: supratrochlear artery, supraorbital artery, and zygomaticotemporal artery. So here auriculotemporal artery and superficial temporal artery, and posteriorly lesser occipital nerve, and here posterior auricular artery. Then greater occipital nerve and occipital artery. Venous system is again supratrochlear and supraorbital nerve, they unite to form the facial nerve, facial vein. And facial vein, here this is superficial temporal vein and posterior auricular vein, they actually join together to form the retromandibular vein. So names of the veins of the scalp are same as the blood vessels. Whereas you can see the venous drainage. Venous drainage is actually here mental lymph nodes, submandibular lymph nodes. Then we have got parotid or preauricular lymph nodes. Then we have got deep cervical, upper part of the deep cervical lymph nodes, and then occipital nodes. I would be showing the same thing in another diagram as well. Okay, so this was brief. Here, preauricular, then mastoid in the orange, then superficial cervical, deep cervical, and parotid or and then submandibular lymph nodes. So all the lymph, it finally drains into the venous system. So this is the sebaceous cyst. This sebaceous cyst actually, develops within the skin of the scalp, and this condition is called Kaffel hematoma. During delivery, after application of the vacuum delivery or forceps, the baby develops a swelling on the head. This swelling is called Kaffel hematoma. It is actually bleed, and it develops between the pericranium and the bone. So this is Kaffel hematoma, which subsides after some time on its own. There is no need to, you know, get anxious about it. So this was, bit brief about, this. Look at this thing. This is facial nerve. Facial nerve, after coming out of stylomastoid foramen, it actually divides into the five, nerves, five branches of facial nerve, which supply the muscles of the face. Here you can see. So as we know that occipital and frontal belly of occipital frontalis muscle actually, they are part of facial muscle, so they are also supplied by the nerves, which are branches of the facial nerve. So frontal, belly supplied by the temporal, whereas occipital belly is supplied by the posterior auricular. So this was brief about the scalp. Thank you very much.